A fifth metatarsal fracture of the foot is a very common injury in athletes and active people. So in this video, I'll discuss the different types of fifth metatarsal fractures and when surgery is needed, when the patient can avoid surgery. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Now, the fifth metatarsal fracture, if you watch, especially pro football or pro soccer, you hear of this injury all the time. It happens in pro basketball, in the NBA, college basketball, college football, very common. The metatarsals, if you're looking at the foot, are the long bones here in the foot, basically below the toes. There's five, just like there's five toes. The fifth metatarsal is on the outside of the foot. You can feel this bony prominence at the base of the outside of your foot, and it's the long bone that runs basically down to the base of your little toe. Now, this can be an acute injury or it can be a stress fracture. And when I say there's different types, some of that depends on how old the person is. If it's a kid, basically, very often they break the tuberosity, right there, the bony prominence right there, and that can heal without surgery. In older patients, women in their, say, 40s, 50s, and beyond, that get it either by inverting the foot in a sprained ankle type of thing or as an overuse thing, again, it's typically at that bony tuberosity. Very often that heals. The ones to watch out for are the ones more in the shaft of the bone, the long cylindrical part of the bone, not so much at the base of that bone. And this can be a stress fracture in a younger athlete, teenage years, but especially, college age and 20s, maybe early 30s, if that's a stress fracture, or an acute fracture that breaks there. The reason that's a big deal is those are much more likely to not heal, go on to what we call non-union if you just try to put somebody in a boot. And so what type it is, where on that bone it is, how old the person is, what they do activity-wise largely dictates the treatment. If it's an injury of that tuberosity at the base of the bone, again, your kids or your older adults, you could put somebody in a boot. That almost always will heal without surgery. But if it's a stress fracture or an acute fracture of the shaft of the bone, or at what we call the junction between the metaphysis and diaphysis, what the terminology sometimes you'll hear is a Jones fracture. In an active person or athlete, that very often needs surgery. That surgery will entail either putting a screw down that bone or using a plate and screws. I always liked using a screw down the bone. I always felt that had a good success rate. Typically, again, in pro athletes, football, soccer, basketball, maybe college age athletes, that is something that's almost always going to require surgery just based on where that injury occurs. And you want to minimize the chance that that doesn't heal. And so that's why that can be such a big deal. Fortunately, the recovery is fairly regular. Most of those go on and heal. I know in the pro athletes, sometimes they don't. And that's something, it could be pushing the recovery or the rehab too fast while that bone is still trying to heal, or maybe not a big enough screw or a steady enough fixation was used during surgery, so they have to go in and revise it. But the success rates of that surgery in terms of return to play at the same or higher level are typically very, very good. Now, I'd love to hear your experience with your foot injury, especially if it's a fifth metatarsal fracture. Leave those in the comments below. Just understand, if you leave a question requesting medical advice in those comments, I can't offer you medical advice, so I will try to address that topic in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start a new live stream, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.